just had a birthday, and it was a significant, pretty big birthday. And I was starting to look really good for my age, which is different than not looking your age. I always looked younger than I was, especially in my 30s. 30s, I looked like I was 20. My 40s, I looked like I was maybe in my 30s. I knew that the birthdays were getting more significant, but I still thought I looked all right. All of a sudden, I think with COVID, wearing a mask, you're more conscious of your face. And I took my mask off maybe a year ago and said, geez, you look old. What happened? These years are catching up with you, and you look good for your age. And that just wasn't going to work for me. But I was scared. I was very, very concerned. I knew the answer wasn't fillers. I had played around with Botox, done a little bit of Botox between my eyes, maybe a little bit of filler because I was looking unhappy. Even though, sometimes you don't smile, your mouth is just together because you're thinking. And when a friend looked over and pushed the corner of my mouth up and said, don't look so unhappy, I realized it was time for some fillers. I've got to push this out or something. So I had been playing with that for about 5 years since that really, really big birthday. But it wasn't enough anymore. And that meant, dun 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 dun, I think I want a facelift. And where do I begin? And Hollywood people and movie stars get facelifts and they go to the best, and that's what I need. Oh dear God, I don't have a private plane or a huge amount of accessible cash. I've got to do some research. And we live in Atlanta, and it's a large city. This is my home. It's a beautiful city. But when you actually go into Google and you look for a plastic surgeon, it's daunting, it's scary. There are so many. And that's when I realized that there are plastic surgeons, then there are specialists, and then there are those that only concentrate on your face. And for me, that was the choice. I didn't want somebody who only maybe did 2 faces a month, but did a lot more mommy makeovers and liposuction, all that good stuff. I wanted somebody, because what was important to me wasn't the facelift so I could say I had a facelift. It's a facelift so nobody knows. So I look like me. I never looked like Cindy Crawford or Christy Brinkley. And don't get me wrong, they're gorgeous. But if I suddenly walked around with Cindy Crawford's cheekbones and Christy Brinkley's eyebrows or something, that's not me. I'm not that movie star. I just wanted to dial it back. Finding Dr. Robb was, I hit the jackpot. I never won the lottery, but I won the lottery with this man. Respect him immensely. He is so gifted. He's a man of faith. I think he's been trained very well. It's a perfect storm with this man. He has training, he has the education, he also has the personality to reassure you, to explain what you know nothing about without making you feel stupid. He walked me through it, no pressure at all. I'll be honest with you, that list that I had from Google, I culled it down to folks that only worked on faces. Some people had 20 years of experience, 35 years of experience. They're wonderful, wonderful, wonderful specialists out there. I went personally to 3 of them and interviewed them, to find out, what do you think I need? How would we work together? Because let's face it, when you're going to be on a table unconscious, you're literally not just putting your life in their hands, but you're putting your future in their hands. I was confident that I made the right choice. And then it took about 3 or 4 months until my schedule was where I needed it to be. Because again, this is a facelift that I don't want anybody to know about. I'm willing to share it with you now, but this is not something that I want my mom or my best friend. I just wanted to be the best me. And here I am, I'm almost 9 weeks out. They tell me I still have a little bit of swelling that's gonna go down. Great, bring it on. Dr. Robb did I had a facelift, which of course now I understand the terminology. Facelift is neck and a lot of work here. A lot. I didn't realize so much of my aging, and it happened in the last 3 years, I would say. Like maybe from 51 to 54. Hereditary, my family does get a little bit pouchy. And that was why my friend thought I was unhappy. Because if I wasn't smiling, this just wasn't up. I used to have nice cheekbones, but with everything, I was hoping that Dr. Robb would be able to dial me back 5 years, 8 years, and that would be great. If you could take me, I'm going to be 55. This was my thought back in April and May. I'm going to be 55, and if this gentleman can take me maybe to 47, 48, because I didn't want my expectations so high that I'd be disappointed. I was confident in my decision. I knew who my doctor was going to be, no doubt about it. But let's face it, well, what can you do with this? I have a lot of wrinkles here. Well, this is what he did with it. This is me. And I know what you think. I don't look good for my age. I look better than my age. And when people now tell me, you're not getting any younger, really? Maybe you're not getting any younger, I just did. I look at my own pictures of what I looked like at 20, at 30, at 40, and today. In fact, for Dr. Robb, you have to bring that in. He wants to see you. He's not working on Cindy Crawford. He's not going to make you look anything except like you. And that, for me, was huge. Because there's nobody else that's me. I'm stuck with it. I mean, I wish I was on the cover of Vogue or something. That's not me. I've accepted me a long time ago. I just wasn't quite ready. I wanted a few more years before I looked like I could be a grandma. You know what? I'm not a grandma. So, nobody's ever gonna know. I am excited. It's wonderful. If you are not quite sure, Dr. Robb is great at suggesting things. I knew I needed the facelift. He suggested that, I don't even know how to say this right, it's a lower left something, an upper. I went to, told you, 3 different people, and they told me a lot of different things. Some folks thought I needed to have my forehead lifted. I had some people who thought I needed my eyes upper and lower. I had some people who wondered if I wanted bigger lips, which is wonderful. They're offering you what they're able to do. But with Dr. Robb, I felt like it was a partnership because I'm happy with my forehead, at least at this point. I'm happy with my lips. He suggested the lower eye. Well, I didn't know what eye bags were. He taught me a lot. He also suggested something about your cheeks. Yeah, I used to have these high cheekbones. Well, my high cheekbones went away in the last several decades as the fat in my cheeks started to slip. Didn't even know that could happen. So we did do 3 procedures all at the same time. So my recovery was really cool because we did it all once and done. I had the lower eyes, I think it's pronounced buccal, fat removed, and I had a facelift. I'm almost 9 weeks out. Dr. Robb Plastic Surgery, because you are.